Welcome to Medicine in Small Doses with Dr. Amobi. I'm your host, Uju, and today we are talking about another topic that really affects millions of people around the world. Today we are talking about asthma. If it's the first time that you are tuning in, then this podcast with Dr. Amobi is something that we use to enlighten our community about how lifestyle and the way people live their lives can impact their health. If you're not familiar with Dr. Amobi, he is a general practitioner, health coach, speaker, lifestyle medicine consultant, and dedicated force in enhancing health across Africa. Like I said, today's focus is asthma. And now over to Dr. Amobi.
Hi, how are you?
I'm doing great, thank you.
Excellent.
What we're talking about today is a condition that affects millions.
Yes.
Something I can personally relate to as I experienced it quite severely as a very young child. So we're talking about asthma. But before we get into the intricacies of asthma, can I start by asking you, Doctor, what is asthma?
That's a very good question. Asthma is a very common lung condition, and it affects your airway. Your airway is responsible for taking, carrying air in and out of your lungs. It's estimated that about 300 million people worldwide have asthma. And in the US, I think it's about 1 in 10 children. In the UK, it's about 1 in 11 children. Mm-hmm. And in adults in the UK, specifically, it's about 1 in every 12 adults. Wow. So presently, we diagnose this condition, and the rate is going higher. Mm-hmm. But the good news is we're finding good treatments, which we'll talk about later. So what happens in people who have asthma? People who have asthma, their airways will become sensitive to something, and we call it triggers. Mm-hmm. So when their airway becomes sensitive to whatever it is that is going to trigger it, it will become inflamed. So symptoms such as coughing, feeling breathless, wheezing, and chest tightening will tend to occur in these individuals. For most people, it will come and it will go. Mm-hmm. I've seen patients who had childhood asthma and they would never have any symptoms ever again. And then we have people who would have it, and then it gives them only few weeks or few months respite. So it changes a bit for people. Now, it's typically influenced by both our genetics and our environments. And again, the symptoms are set off by various, behaviors and our surroundings, as I said. So we need more research, mm-hmm. but there are certain factors that contribute to asthma. For example, in children, air pollution, mold in the house, secondhand smoking, obesity, their diet, mm-hmm. Tend to have a lot of influence in getting asthma. So that's in a nutshell. Mm-hmm. The medical definition is an airway that is sensitive to something that becomes inflamed. And as a consequence, you start coughing, you start wheezing, you start having chest tightness, and you get shortness of breath.
Thank you for clarifying that. In your last talk about asthma in the UK, you stated that an average of 3 people die in the UK every day due to an asthma attack. And every 10 seconds, someone has potentially a life-threatening asthma attack. My question is, in terms of asthma, what are the symptoms and how do you know that you are having an asthma attack? Yeah,
so asthma attack is a very terrifying. When I used to work as an emergency medicine doctor, mm-hmm. when you see somebody coming in with an asthma attack, you don't need a reminder that this is a critical of the highest order, and this in people who have an asthma attack, it happens when the asthma get worse. Sometimes it can be sudden. So all of a sudden somebody encounters something that will trigger off their asthma, and then boom, all those 4 symptoms, they start wheezing a lot. They start coughing a lot. They start experiencing, chest tightness getting bad. they can't talk in full sentences. Let's say somebody want to say good morning. They won't even be able to complete that in a full sentence without even starting at good and then take a deep breath in and go to the morning part, right? So, the breathing speeds up. The heart rate is fast. They're feeling tired. They're feeling dizzy. Sometimes their lips turn blue. Their fingers turn blue. Sometimes they may faint. So these are symptoms that will tell you that, hey, I am in trouble. If you live in a country where there's ambulance service, this is your time to call an ambulance right away.
Okay.
I understand that in many African countries, there may not be emergency services where you can actually call. So this is where having a very clear-cut plan with your doctor about what you do in emergency. So take, for instance, in the UK, if somebody is having an asthma attack, the advice we normally give them is to, number one, to sit upright. So don't lie down. So you sit the person up. And then using a spacer is a machine or a little hollow tube where you put your inhaler in to allow you to breathe in and out properly, because it's quite difficult for somebody to just put inhaler in their mouth when they're out of breath to do the breathe, to follow all the steps. So we asked them to take one puff of the blue inhaler called salbutamol every 30 to 60 seconds up to 10 times. And then the next step we normally advise is that if your symptoms are not improving within 15 minutes, or you feel like it's still getting worse, you ring 999 and repeat the same step again, another one puff every 30 to 60 seconds up to 10 times. And then you call an ambulance. So I don't know exactly what what people use in, let's say, in some of the African countries. But what I do know is that there's a global asthma network called GINA, G-I-N-A. That's the initials of that. If you look it up, most of the African countries are beginning to adopt GINA protocol at the moment. And what I've just said is consistent with what we do in asthma attack.
What was that again? GINA, G-I-N-A. N-A.
Yeah.
Brilliant. We'll put it in the show notes.
Yeah.
That's great.
We can put that in the show notes. Yeah.
Okay. Let me kind of dial back a bit. If you see a patient in clinical practice, what would make you maybe think or diagnose? What would be the thing that diagnoses it as asthma to stand out, I guess?
Yeah. So I think diagnosing asthma have different forms and involves, ongoing airway inflammation. So the things that would make me think about asthma, number one is, of course, the symptoms of the airway restriction or the airway inflammation. A, wheezing, shortness of breath, chest tightening, coughing, and then whether there is any changes in intensity of it and how frequent are they getting this, all of these symptoms. Now, sometimes these symptoms tend to worsen in the morning or at nighttime. So we call it diurnal variation. So now another thing as well is asthma patients often have multiple symptoms and they vary over time. But if the frequency of it start changing and they have recurrent chest infections, for example, I would worry about asthma. Family history is equally important. So if your father, your mother, your brother, your sister have asthma, I'll look very closely to asthma. People who's had it as a child, say if I'm seeing an adult, I would think, have you had any asthma as a child? There are other symptoms of allergies that will again point me towards possibility of asthma. So take, for example, people who have eczema. People who have eczema are likely to have asthma. People who suffer from hay fever are likely to have asthma, right? So all of those things will point me towards a possibility of having asthma.
Most of our audience are Africans, in part because of your quest to bring more information to people in our community. You have worked a lot within the Black community also here in the UK and championed Black health. I have to admit that when someone says diabetes or hypertension, I know black people will be in that mix. So is asthma equally as bad? Is it?
Yeah, I would rank asthma very close to that, and that's a very good question, because I think diabetes, hypertension, and rightly so, are being talked about and spoken about a lot within black health. But one area or people very seldom talk about is asthma. And that's the language that I'm hoping that by giving this talk, that it would change. Take, for instance, in Africa, many people are affected by like infectious diseases, and because of these diseases that are not easily spread between people, like asthma, don't get as much attention as I said. So and even though asthma can be usually treated with medicine that's available in most public hospitals in Africa, more and more people are dying of asthma, and this is worrying. So it is something that we need to take very, very seriously. So when I was preparing for the talk I gave previously, and of course in this one, in kids aged 13 to 14 years old, black African children, the prevalence of asthma is about 15.3%, and which is higher than the global average. Then I looked into Nigeria statistics. I was astonished to actually see that between 15 to 20 million people in Nigeria either have asthma or have asthma-like symptoms, right? In the U.S., if you look at the black population in the U.S., which is about 13.6 of their population, black children have 2.5 times more higher asthma rates and far more greater mortality. So they die more from asthma than any other race. Then when you look at the UK, where we are presently, 160,000 people get diagnosed each year because of asthma. But the significant proportion of them are black, even though we make up only 3% of the UK population. It goes to show that wherever you are, whether you're in a country that is predominantly black, or whether in the Western world, our proclivity to getting this disease is higher, and people need to be educated about it and understand that if your child is, or yourself is wheezing a lot, coughing a lot, getting a lot of chest infection, please, if you don't have any takeaway today, that is, go and get it checked just to make sure. And we will talk about the diagnosis. I don't know whether you're going to ask me a question about diagnosis, but the diagnosis is super important. There are certain things that we can even start you on some medicines to see whether it's asthma or not. So diagnosis shouldn't take long, but you have to really get something. But I think if we talk about it, then I'll be able to add more input to it.
Okay. I'm just going to dial back to the talk that you gave and just make a point from the talk that you gave a few weeks ago about menopause. And in that talk, you discussed that women who are in the menopausal, perimenopausal stages can be susceptible to asthma. So as a female, and for a female audience, as a woman myself, especially because I experienced it when I was a lot younger, what kind of things do we have to do in order to prevent or prepare for this possibility? Can you speak more into that?
Absolutely. So we do know that hormones like estrogen and progesterone, which are involved in things like period and pregnancy, can sometimes make asthma worse. And about 1/3 of women notice that their asthma symptoms are getting worse before or during their period. Some women, especially those with severe asthma, might have even worse symptoms while they're pregnant. However, many women do feel better or see no changes during their time of pregnancy. But in terms of your question specifically about menopause, that's actually correct, because we know that sometimes asthma symptoms can get worse during the menopause transition period. So we're not completely sure exactly why this happens. However, the suspicion is that these female hormones can trigger asthma. and they can make you more sensitive to other things as well that trigger asthma, things like hay fever, getting cold or flu symptoms. So the most important thing here is if you find yourself needing to use your blue inhaler or whichever, well, we use blue inhaler here as salbutamol. I don't know what the color of salbutamol is elsewhere in the world, but the salbutamol here is the quick relief inhaler one. So if your symptoms, or you start noticing that you're needing your quick relief inhaler every 3 to or more than 3 times in a week, then that's a very smart time to go and see your doctor, if that makes sense.
It does, doctor. Thank you. What I want to ask, how can we lower the risk of female hormones triggering asthma? Okay,
I think, so what you're asking basically is, since we know that the hormones can actually increase the likelihood of asthma triggering off, so what can you do?
Is there, if anything, to reduce that happening, the chances of that happening?
Sure. So the best way to lower the chances of asthma problems caused by things like in hormones, is by watching out for your common triggers. So these are things that normally make your asthma worse. So what should you do? I would, number one, make sure that you take your daily medicine to prevent asthma. So this is usually the other colors like brown, pink, etc. But please make sure, because there are 2 types of inhalers. There is a quick relief, and then there's one that you need for long term, right? So I always say to my patients, your quick relief one is like your overdraft. Your other ones is like your main bank account, right? Okay. So you need your overdraft when you desperate to get some money, but your main account is what keeps you going. So it's super important that you have an asthma plan. So take your medicines, number one. See your doctor at least once a year to make sure that your asthma medicine and your asthma plan are up to date. Okay. I cannot highlight the importance of asthma plan enough, because in my practice, every single person with asthma have an asthma plan, and we make sure that we update them every year. And we even make sure that they report whenever they go to hospital or whenever they start needing their blue inhaler more. Because if you keep it optimal, you can live life without needing those inhalers. But that has to be a conversation you have between you and your doctor.
Okay.
Yeah, so keeping track of your symptoms is super important. But, like you said earlier, most of our audience are in Africa. So, one of the things that I would advise for you, if you're in Africa listening to this, is go to your doctor. If you have asthma, please ask them for an asthma plan. What do I do in emergency? There is a new global collaboration at the moment to make sure that everybody is treating asthma very similarly. Okay. So the way that we're treating it in the UK, in the US, the expectation is that will be treated in Africa to some degree. Now, there is a small caveat to that. Of course, doctors in Africa face way more significant challenges than we in the West when it comes to asthma management. Okay, so and I think you mentioned that earlier today to reference that in the conversation. So so it is super important for you to go to your doctor and have an asthma review.
It's like, Doctor, you preempted what my next question or line of questioning was. Obviously, the challenges that doctors in Africa face when diagnosing and treating illnesses and diseases such as asthma. What are some of the key challenges that you've come across or discussed in your network?
Yeah, so I would say number one, lack of access to medications. The availability and affordability of asthma medication can be a significant challenge for anybody who's working across them. That's one of the things my colleagues there have echoed. I've written to some of the Nigerian experts and some Ugandan experts to bring them onto the podcast as well, so that they will be able to have a chat about the experiences in managing from their own perspective. So diagnosis and awareness. because asthma is not one of those things that people tend to encounter a lot, so many people or some clinicians may not be up to date with most recent asthma diagnosis protocol. Now, patients presenting late, somebody needs to come to you with an asthma for you to treat it. So if patients do not know what the symptoms they should be looking out for, then that's where the problem is. So healthcare infrastructures, you appreciate that, particularly in rural areas, they may lack the infrastructures, equipments, and the personnel training and things like that. So here, for us to diagnose asthma, the gold standard is a spirometer, which is a big machine that you breathe into that will tell us whether you have asthma or not. Some places in rural Africa may not have that. Okay, so then, shortage of like healthcare workers.
People that actually do the work.
People that actually do the work, like the pulmonologists, people who work in the lab to have a look at the spirometer, like we said, or doctors who are trained, people have moved out of the country. Yeah. I had a conversation with that, someone quite significant from Kenya. And one of the things they would be decrying was that most of the healthcare professionals are, moving away from their countries, so those resources are quite significant in terms of, having sufficient workforce to deal with this. Then you're talking about environmental factors, you're looking at air pollution, allergens, smoking, all of those things, and adherence to medicine. People need to understand what they have to be able to adhere to medicines and things like that. So it must be very, very challenging.
Sounds very challenging.
Yeah.
When you say adherence to medicine, is that even how to take the medication?
Yeah.
Okay, right.
Yeah.
I can see that being, yes.
Yeah.
Okay.
So even socioeconomical factors, they think about sanitation and clean water. If people are exposed to something that triggers off their asthma, it may be difficult to contend with, Yeah. And then I would say, in my estimation, one of the biggest barriers would be limited research and data. I had to scour through a lot of studies after studies to actually see something very meaningful that is comprehensive on the prevalence of asthma, the outcome, the effectiveness of the treatment within asthma, within African population. And one of the things that pushed me to do that is because some evidence shows that there are certain medicines that work for other communities that may not work so greatly for us. So I was looking into to see if there is any study in Africa in terms of whether this is as a consequence of genetic predisposition, or is it because we're not using it properly? But the data from Africa is lacking extraordinarily. And if there's one thing I would like to see is for us in this 2023 to start gathering data for our communities and so that people can actually find a way to help. Yes.
Crucial.
Yeah, that's crucial.
Well, that was a comprehensive list in itself, and I know there's more to it.
Sure.
So obviously addressing the challenges that are faced requires a multifaceted approach involving governments, organizations, healthcare institutions, local communities. Efforts should be, which are going to focus on improving access to essential medications, strengthening healthcare infrastructure, increasing awareness and education about Africa, particularly within an African context. Sounds like there's a lot. It's going to take a huge effort, basically. Absolutely. Yeah, it's something that would take significant approach. Yeah. Is there anything you want to kind of your last thoughts or comments in relation to asthma, particularly within the African context, before we conclude? Yeah. I know we're running out of time, but research is looking a bit more into other things that we can do on a day-to-day basis that can improve asthma. So research is indicating that low levels of vitamin D may be connected to, asthma in children, connected to wheezing and things like that. So making sure that you maintain adequate vitamin D levels. In the UK, it's mandatory from birth.
for everybody to take vitamin D until the day they die, basically. So I wouldn't see why people in Africa shouldn't be doing exactly the same. So, but make sure that you speak with your doctor about, they can do blood tests or your vitamin D level to establish that you're running low on anything. So that's number one. Number two is we know that the shift from rural to urban areas. So if you used to live in a village and then you move to city, the more urban area that you live in, the more likely you're going to be exposed to asthma. Because research indicate reduced exposure to beneficial bacteria within the environment where you are in. So in the UK or in the West, we know that children who are born in the farms exposed to several types of different bacteria, have lower allergy and asthma risk. Okay, so it's called the hygiene hypothesis. So it's not that cleanliness is not important. Cleanliness is absolutely important, but we know that children who live in rough and tumble, work in the farm, etc., have lower risk. Now, lastly, and equally as important, is we know that obese children have higher risk, or anybody actually who have high BMI or who are overweight are at risk of asthma. Children gaining too much weight can develop wheezing and asthma. In pregnancy, extra weight, increases basically your child risk of asthma, right? So, and if people who give birth to big babies, we know that big babies also face higher risk of asthma. So to conclude, I would say speak to your doctor. Get the proper asthma diagnosis. Now you've learned about what symptoms to look out for. Now you have an idea of what type of treatment that we typically give in the West. You can reflect that to your doctor. You can ask your doctor to listen to this podcast as well. Everything that you do, make sure you're working in conjunction with your doctor. And the more we hear, the more new studies or evidence come up, we will endeavor to update you as well.
Brilliant. Thank you so much, Doctor. That was a really enlightening episode. And if you enjoyed this episode, as Doctor said, please share it so more people can have access to this information that could potentially save lives. As always, thank you for tuning in, and we'll see you on the next episode. We would lastly appreciate a 5-star review, and this way more people can find the podcast. Until next time, remember to stay curious, stay empowered, and keep tuning in to Medicine in Small Doses.